Welcome back to the deep dive. Okay, let's play a little word association game. If I say Canada, what do you say?
Ah, cold, hockey.
I was thinking free healthcare. I mean, it's arguably the biggest part of the Canadian brand, right?
Yeah.
You get this romanticized global view of a utopia where you could walk into a hospital, get amazing treatment, and then just walk out. No wallet involved.
Right.
And that's a huge selling point, especially when you look at something like the 2026 immigration levels plan we're digging into today. The promise is security.
It is a really powerful promise, but, and we're going to be saying but a lot today,
Right.
when you start to strip away the branding and, actually read the fine print.
In this Healthcare in Canada guide from Dara Immigration Services.
Exactly. The reality is, well, let's just say it's a lot more bureaucratic than the brochure leads you to believe.
Bureaucratic feels like a very polite word for potentially really expensive if you don't know the rules.
That is a fair way to put it, yeah. The big headline here is that universal coverage does not mean total coverage. And it definitely doesn't mean instant coverage.
Right. And I think that's the distinction we really need to unpack.
Mm-hmm.
Because the assumption for most people, I imagine, landing in Toronto or Vancouver is that the system is, national. You
Yeah.
land in Canada, you get Canadian healthcare, period.
And that's the first myth we have to bust. It is not one national system. It's really a collection of 13 different insurance plans, all sort of held together by a federal funding agreement.
13.
13. And if you don't understand the specific rules of the province where you're actually living, you can find yourself in some pretty serious financial trouble.
Okay, so our mission for this deep dive is clear. We need to dismantle that romance and look at the actual machinery. We need to give you a blueprint for how to survive those first critical months without getting a bill that just ruins your fresh start.
Exactly.
So let's start with the basics, the foundation. People throw this term single payer around all the time. What does it actually mean?
It's the core of the whole structure. So in Canada, the government, the single payer, uses our tax dollars to pay for health services. But, and this is a really crucial point, the delivery of that care is private. Your family doctor isn't a government employee. They're basically a small business owner who bills the province for their services.
Okay, so the government is footing the bill, which means, for me, it is free. Theoretically.
Theoretically, yes. For what they call medically necessary services, so a doctor's visit, a surgery, a hospital stay, it is free at the point of service. You show your health card, you get the treatment, no invoices, no copays.
Okay, but medically necessary. That sounds like a phrase that has a lot of wiggle room. Who defines that? I mean, if I have a horrible toothache and I can't eat, that feels pretty necessary to me.
And you've just hit on the exact friction point. This is the Swiss cheese model that the DIS report talks about.
It's cheese.
Yeah. The Canada Health Act essentially covers your body from the neck down, but it kind of skips the mouth and the eyes. Historically, things like dentistry and optometry were just seen as private responsibilities.
So the system will cover my heart attack, but not the cavities and inflammation that might have led to the heart attack in the first place.
Precisely. It's a disconnect that's been there for decades. The source is really clear on this. If you try to rely only on the public health card, you're going to have huge gaps in your coverage. We're talking vision, dental, and the really big one for most families, prescription drugs.
Wait, hold on a second. So if I go to the doctor with a really bad infection, that visit, the consultation, is free.
Correct.
But the antibiotics I need to actually cure it.
You're pulling out your credit card at the pharmacy. That is, unless you have a private insurance plan or you qualify for a specific low-income program.
Wow. That feels like a system designed to, I don't know, diagnose the problem but not necessarily help you fix it.
It's a cynical take, but it's not entirely wrong. And that brings us to the strategy part of this. Most Canadians don't just rely on the government card.
They can't.
Right. They rely on a mix. You have your public card for the hospital, and then you have private insurance, usually through a benefits package at work, to cover that other, 20%.
So if you're a newcomer and you're looking for a job, you're saying the salary is almost secondary. You need to be looking at that benefits package.
100%. A job that has dental and drug coverage is effectively paying you thousands of dollars more a year than a job that doesn't. It's a critical part of the whole compensation calculation.
There was another specific cost in the report that really jumped out at me. It's one that seems to catch everyone by surprise. The ambulance.
Ah, the ambulance ride, yes.
I think most of us just assume, 9/11 is a public service, so the ride to the hospital must be part of that medically necessary package.
It's a logical assumption, but it's wrong. In many provinces, an ambulance is officially considered a transportation service, not a medical one.
That is a wild distinction to make.
It's the reality. The source points out that in big provinces like Alberta and Ontario, unless you have a specific exemption, like being a senior or on social assistance,
Yeah.
you're getting a bill in the mail.
And we're not talking about some, like, $10 token fee here.
No, not at all. It can be
Yeah.
as low as maybe $45 in Ontario, but it can jump all the way up to $385, depending on where you are and what the call was for.
Just imagine that. You're having a medical emergency, the worst day of your life, you get rushed to the ER, and 3 weeks later, a bill for $400 shows up just for the ride.
It happens every single day, and if you don't have private insurance to reimburse that cost, it's coming straight out of your grocery budget.
Okay, so the system is Swiss cheese. It's full of holes.
Yeah.
But the size and shape of those holes, it depends entirely on where you live.
Geography is destiny in Canadian healthcare. That's the bottom line.
This is the part that I think confuses people most. It's not one map. It's 13 different maps. So I want to take a little cross-country tour, if you will. Let's go through the geography and see just how stark the differences are.
Let's do it.
Okay, let's start where most immigrants land. Ontario. Now, Ontario used to have a waiting period like everybody else, but that changed. What's the deal for someone landing at Pearson Airport today?
It was a big strategic shift. So according to this 2026 snapshot, Ontario has completely waived the traditional 3-month wait. They figured out that having thousands of uninsured newcomers was actually a bigger strain on the ERs than just covering them from day one.
So it's a preventative move. Cheaper to treat a small problem early than a big one later.
Exactly. So if you're an eligible resident, you've got your permanent residency or a work permit for at least 6 months, your OHIP coverage starts immediately. You aren't gambling for those first few weeks.
That's a huge weight off your shoulders.
Yeah.
But back to the Swiss cheese idea. Ontario has a really weird gap when it comes to age, doesn't it?
It does. It's a quirk that catches a lot of people. Ontario's public drug plan, it's shaped like a dumbbell. It covers kids under 24, and it covers seniors over 65.
And everyone in the middle. The main working age population.
You're on your own. Unless you have private insurance or your drug costs are catastrophic relative to your income, the government just assumes your employer is paying for your pills. So if you're 30, you get a sudden illness. OHIP covers the doctor, but you're covering the meds.
And there was a specific warning in here for students in Ontario.
Yes, international students. They often think, I live here, I get OHIP. They don't. They're ineligible, and they must buy something called UHIP, the University Health Insurance Plan. It's mandatory.
Okay, let's head east. Quebec, they always do things a little bit differently.
The unique case, for sure. Quebec has a huge amount of autonomy.
The source uses a phrase here that sounds almost aggressive. Mandatory drug insurance.
It is aggressive, but it's also really effective. Quebec has a law that says every resident must have drug coverage. It is not optional.
And what if my job doesn't offer a plan?
Then you are legally required to enroll in the government's public plan, and you pay a premium for it right on your tax return.
So they basically force you to be insured.
Correct. They see it as ensuring universal coverage by mandating the contribution. It stops people from opting out and then becoming a burden on the system later.
What about that waiting period, though? Ontario is immediate. Quebec.
Generally, no. There's usually a waiting period of up to 3 months before your RAMQ coverage kicks in.
3 months is a long time to hold your breath.
It is. Now, there are some exceptions. If you're coming from a country with a social security agreement, like France, you might skip the wait. But for most newcomers, you need a plan for those first 90 days.
All right, let's fly west. British Columbia. This is where the source material started to feel a little scary, cost-wise.
BC is beautiful, but it's not cheap. They have what you could almost call a sunshine tax.
Well, sunshine tax.
Yeah. While a lot of provinces got rid of their monthly health premiums, BC still charges one for international students and some temporary workers.
How much are we talking about?
It's around $75 a month.
Ouch. That adds up. But the bigger risk in BC isn't the fee, it's that waiting period.
Right. BC has a very, very strict waiting period. It's basically 3 months.
I just want to pause on this because I don't think people grasp the stakes. So I land in Vancouver, and on day 45, I trip on the seawall and break my leg. What happens?
If you don't have private gap insurance, you're in a world of trouble. A standard hospital room in BC for a non-resident, we're talking upwards of $3,000 per night.
per night.
Just for the bed.
Look.
That's before the doctor's fees, the x-rays, the cast. You could easily have a $10,000 bill for a simple broken leg.
That's life-altering debt.
It's financial ruin for a newcomer.
Yeah.
And that's why the advice is so blunt. Do not mess around with the waiting period.
Okay, let's pop over to the prairies. Alberta.
Alberta is interesting. It's actually very welcoming in terms of initial access. Under their plan, AHCIP, coverage begins on the date you arrive for permanent residents and eligible workers.
Okay, so similar to Ontario, land and you're covered.
Yes, but without the monthly fees for temporary folks that you see in BC, it's much more straightforward.
But don't forget the ambulance.
Right. You get the doctor for free on day one, but you take an ambulance to get there, you're paying for it.
And finally, Atlantic Canada. Nova Scotia has a bit of a math problem for us.
It does. Their waiting period is calculated very specifically. It's the first day of the third month after you arrive.
Okay, so walk me through it.
Yeah.
I arrive in July.
You arrive anytime in July. August is month 1. September is month 2. Your coverage starts October 1st.
That feels so oddly specific.
It's bureaucratic precision. But the danger is if you miscalculate and think you're covered on September 1st, you've got a 30-day window where you are completely vulnerable.
So we've covered the map, we've covered the costs, but there's another really big layer here. We have to talk about access. Because having the card in your wallet is one thing.
Actually seeing a doctor is something else entirely. This is what we're calling the crisis of access. And to be honest, this is the most relevant part of the conversation for anyone arriving in 2026. The system is under incredible strain.
I want to focus on that term, universal access, for a second. Because universal sounds like the door is wide open.
Yeah.
But from everything I'm reading, it sounds like the door is open, but the hallway is just jammed with people.
That's a very good way of putting it. The report cites a staggering number. Over 6 million Canadians do not have a primary care physician right now.
6 million. That's, what, 15% of the whole population without a family doctor, a medical home? So for a newcomer, what does that actually look like on a Tuesday morning when they wake up sick?
It looks like fragmentation. The old model of one doctor who knows you and your family for 20 years, that's collapsing. Newcomers are entering a system of what we call episodic care. You're not looking for a relationship, you're just looking for a transaction.
Which means walk-in clinics.
It means walk-in clinics. You go to a clinic, you wait your turn, which can be hours, and you see a doctor for that one specific thing.
But isn't that kind of risky? If I go to a different clinic every time I'm sick, no one is connecting the dots for my health.
That is exactly the risk. The source warns against thinking of walk-ins as a perfect substitute. If it's for a simple prescription refill, fine. But if you have a complex, chronic issue, that doctor doesn't have your chart. They have no idea what your baseline is. You are starting from zero every single time.
What about technology? Are things like virtual care helping?
It's become a lifeline, really. Apps like Maple or TELUS Health are the main way millions of people see a doctor now. You get a video call, they can prescribe meds, give you a referral. It keeps people out of the ER, which is a huge benefit.
Okay, here's a question I know people are thinking, especially if they come from a system where money talks. If the line is too long, can I just pay to skip it? Can I pull out a credit card and get seen faster?
This is a huge myth, and we really need to bust it. The answer, for the most part, is no.
Really?
Yeah.
Not even if you're wealthy.
The Canada Health Act actually makes it illegal for doctors to charge for faster access to medically necessary services. You cannot pay to jump the queue for heart surgery or cancer treatment. We are all in the same line for that.
But I see ads for private clinics all the time.
You do, but they are for non-essential services. You can pay for an MRI scan if you don't want to wait for the public one. You can pay for cosmetic surgery, for laser eye surgery. But for the life-saving stuff, no. Your money doesn't make the line move faster.
That's a really important distinction. I guess it reinforces that core value of equality, even if the wait times are frustrating. It's the trade-off.
It is. We trade speed for equity. Whether that trade-off is still working in 2026 is a huge debate, but that is the fundamental rule.
Okay, we've covered a lot. We've scared people with $3,000 hospital bills. We've confused them with provincial math and depressed them with doctor shortages. Let's try to be helpful now.
Let's get to the action plan.
The source has a great checklist. Let's go through it chronologically. I'm storing my home country and packing my bags. What's the #1 thing I have to do for my health?
Pre-arrival.
Yeah.
Check your visa status. Make sure you're actually eligible. But the absolute crucial step, the one I cannot stress enough, buy private travel insurance.
And this isn't just an upsell from an insurance company.
Absolutely not. If you are moving to BC, Quebec, Nova Scotia, or anywhere with a wait time, you need what's called gap coverage. Do not get on the plane without it. Cover yourself for those first 90 days. It's the best money you will ever spend.
Okay, I've landed. In my first week, I'm jet lagged. What's my priority?
Get yourself to the registry. Service Ontario, ICBC in BC, a registry agent in Alberta, whatever it is. Take your passport and your confirmation of permanent residence or your work permit.
And get the golden ticket.
Get the PHN, your personal health number. That number is your identity in the medical system. Even if your coverage hasn't officially started, get in the system, get the number.
And then, long term, how do we solve that Swiss cheese problem?
Two things. First, sign up for the provincial doctor waitlists immediately. Don't wait until you're sick. Find the Healthcare Connect list or whatever it's called in your province and get your name on it. It could take years, so start the clock now.
And the second thing?
The job hunt. When you are looking at offers, look specifically for jobs with benefits packages.
Prioritize the dental plan over everything else.
Exactly. If you have to choose between a slightly higher salary with no benefits or a slightly lower one with full dental and drug coverage, take the benefits. One root canal will wipe out that salary difference instantly.
That is incredibly practical advice. It's about turning healthcare into part of your financial plan.
It has to be.
So to wrap this all up, Canadian healthcare. It's a point of national pride. It's free when you need it most. But it is not simple.
Not at all. It requires you to be an active navigator. You have to be proactive and understand that free doesn't mean totally free, and universal doesn't mean everywhere all at once.
It sounds like a system that works best when you actually understand the rules of the game.
Precisely. Your health is the absolute foundation of your new life here. Misunderstanding these rules is a financial risk you just don't need to take.
And that kind of leads us to a final thought. We always like to leave our listeners with something to chew on.
You know, as we were going through this map, looking at how drastically things change between Ontario, Quebec, BC, it raises a really interesting question about what Canadian citizenship even means.
How so?
Well, we all say that healthcare is a fundamental right in this country. It's a core value. But if your access to that right and the cost of that right changes completely just because you moved across a provincial border, is it really a national standard?
That's a good point. Why does your postal code get to decide if you have to pay for a doctor for 3 months? Or if your ambulance ride is free?
Exactly. It's this tension in the system that's never really been resolved. In a country where we say healthcare is a right, your geography is still, in so many ways, your destiny.
A postal code lottery for your health. Something to think about. Thank you so much for breaking all this down.
My pleasure.
And all of you listening, stay curious, stay healthy, and please get that travel insurance. We'll see you on the next deep dive.